This hospital in Chad's capital is where HAWA MUSA comes to receive prenatal care. It's more than 2 hours away from her home, but it's her first pregnancy and she's been experiencing complications. And with her due date just weeks away, she fears for her life and that of her baby.
I've heard stories of women suffering during childbirth, and I've been getting irregular pains in my stomach. So I come to the hospital to get help because I don't want anything to happen to me.
HAWA says her fear is made worse by the fact that teenage pregnancy increases the chances of maternal mortality. She's only 14, and Chad has one of the highest maternal mortality rates in the world. More than 60% of its nearly 16 million population live below the poverty line. And while access to maternal health care is one of the few services that's offered for free, the rate of women losing their lives during childbirth has not reduced much over the past decade. More than 1,000 pregnant women out of every 100,000 in Chad are expected to die during childbirth or from related complications every year, according to health workers. Several other factors are attributed to the high number of deaths, including lack of enough health workers. Most of the fatalities are recorded in rural areas outside the capital, where access to health care is limited. Less than 25% of pregnant Chadian women have access to medically qualified personnel, and years of conflict in the country's north and east have limited the provision of health services in those regions. The United Nations also says that the country's literacy rate is contributing to the high death rate. 4 out of 5 women between 15 and 24 are illiterate, and health workers say that's affecting women's awareness regarding their health.
Women usually come to us in late stages of pregnancy, and by then they've developed multiple complications. It's because they usually come suffering from malnutrition, high blood pressure, and that's the least. It's sometimes worse. We tell women to come to us as soon as they know they're pregnant so we can give them the right care. But many are hesitant, so when they give birth, there are health risks, not only for them, but for the new babies that are born.
HAWA says she knows the risks she's facing and doesn't want to become another addition to the mortality statistics in Chad. She says she hopes to have a normal delivery, but fears that, at her age, the odds may be against her and her child. Hiba, Al Jazeera, N'Djamena.